Good morning.
Good morning.
Good morning, John.
Good morning. So good morning, everyone. My name is John Mutua. I work at the Institute of Economic Affairs as a programs coordinator, and I would like to invite you to this webinar on women leadership, celebrating women's performance in the provision of public service during the pandemic. So the Institute of Economic Affairs is a think tank that promotes debate and dialogue on public policy issues. We have 5 programs at the IEA. We have a program on public finance management, trade and development, futures and strategic foresight, regulation and competition program, as well as the 5th one is constitution law and economics. Now, the Institute of Economic Affairs would likely like to join other organizations, other like-minded organizations, in celebration of International Women's Day, and just to add our voice into this towards celebration of this day, I have 2 of my colleagues, as you can see from the program, who will be making a presentation. So we have Fiona Okadia. Fiona works in the regulation and competition program, and the other presenter is Dharmi Jata. And the 2 will be just sharing some thoughts and contributing to this debate on women leadership and in celebration of International Women's Day. At the Institute of Economic Affairs, we have done some work in the past, and we continue to do work that's related towards advancing gender equality. Within the public finance management program, we've done a lot of work, and we continue to do work around gender responsive budgeting. We've done work around 2/3 gender rule in terms of just providing debate around the cost of implementing the 2/3 gender rule. And recently we had a webinar and a conversation in Twitter on the constitutional amendment bill, discussing about issues of representation and how, of course, women will be brought into the leadership, and just looking at the implication of what has been proposed and basically weighing our thoughts on the same. And you can catch some of those discussions and the stuff that we've done in our. You can visit our website, and you'll be able to see some of the things that we've done in the past around just issues related to advancing gender equality. So the 2 of my presenters will actually take about 40 minutes, and then thereafter we'll open it up for plenary discussion. So as the presentations go on, please feel free to just note whatever questions or comments that you have in the chat box, and of course we'll come to that during plenary. So I think without further ado, please allow me to welcome the first presenter, Fiona. Fiona, you have about 15 minutes, and Fiona will be presenting on women in leadership. And of course, you will touch on what the theme for this year is on the International Women's Day theme. She will touch on that as she makes her presentation. So Fiona, welcome.
Thank you, John. As John has mentioned, my name is Fiona Okadia, and I work under the Economic Regulation and Competition Program. So before I start my presentation, I would just like to mention that the IEA is part of the team under the Kenyatta University Women Economic Empowerment Hub. And this project has 3 themes. So one is the women's role in the economy, and then the second is violence, crisis, and women work, and then the third is under skills and and mentoring. So what we're doing at the IEA is that we are conducting a research study where we are tracking the effects of budgets and public spending on women and economic empowerment initiative. So with that, I'll go into this year's International Women's Day theme, where they just wanted to celebrate the tremendous efforts by women and girls around the world in shaping a more equal future and recovery from the COVID-19 pandemic. So as you're all aware, women are at the front line of this COVID-19 crisis because they are mostly health workers, they are caregivers, they are innovators, they are community organizers in combating the pandemic. And what this COVID-19 crisis has shown us is that in terms of contributions and also disappropriate burdens that women carry. So I'm just going now into my presentation. So this is the outline of today's presentation, the theme which I've explained, and then the second one is the partnership between IEA-Kenya and the Kenyatta University Women Economic Empowerment Hub. And then I will try and speak on the claim that women leaders are better at fighting the pandemic. And then Dharmi will come in and talk about the contribution of women in both the public and private sector, and also the emerging issues and lessons learned. And then finally, we'll conclude and call it a wrap. So going into the state of play,
Fiona?
Yeah?
You haven't, are you sharing? Are you sharing your, we cannot see your presentation. Or will it come? Yeah, please. Yeah, so we can now see it. Fiona, you can now carry on.
Okay, thank you. So out of the 195 countries in the world, women serve as head of states and government for 22 countries. So this is a representation of 11%. And imagine there are 119 countries that have never had a woman leader. So with such a rate, UN women estimate that gender equality in the highest positions of power will not be reached for another 130 years. So that's a long time. And then looking at the graph on government ministers, only 21% of government ministers globally are women, and mostly they're given portfolios around the environment, gender, employment and labor, social affairs. And then if you look at the graph on national parliaments, only 25% of national parliamentarians are women. So this 25%, for me, it is an improvement because if you check data on 1995, the representation was just 11%. So there's been a 14% increment between 1995 and now. But only 4 countries globally have 50% or more women in parliament. So in Africa, you have Rwanda that has more than 60%, and then you have Cuba and Bolivia that are tying at 53%, and then you have the United Arabs at 50%. So now I come to the claim that women leaders are better at fighting the pandemic. So I'm sure this is a claim that most of you have heard, if not all, that indeed women leaders are better at fighting the pandemic. So it would just be a statement if we don't follow it up with some data. And that's what I want to talk on today. So there's a particular study that was done by Supriya and Uma that was dubbed Leading the Fight Against the Pandemic. So the question that they were trying to answer is, does gender really matter? So what they did in this study was they considered significant differences in the COVID outcomes of male and female-led countries in the first quarter of the pandemic. Then they also considered whether these differences can be explained by differences in policy measures adopted by the male and female leaders. So in particular, the study was conducted during the timing of the lockdown, like when very many countries were taking the way of like locking down their countries in order to try and prevent the escalation of cases and deaths. So two things for you to consider, even as I go into explaining what you can see on your screen, is the timeline. So it's the start of the pandemic, because of course a lot of things have changed from that was around April, March 2020, and now, because it's now a year, right? So and the second is the quality of data. So if you remember correctly, and this is also a problem that we had in Kenya in terms of the testing being done, it was poor, it was low, if I can say that. And then also there was the issue of the testing kits. So because of that, then it shows that probably the number of cases may be underestimated. But now when you look at the number of deaths, that is more accurate. So the sample size for female-led is 19, and that for the male-led is 171. So this 19,000 that you're seeing in terms of COVID cases is a mean, and then the deaths is also a mean of those 19 countries. So this just basically shows you that the number of deaths in female-led countries was lower by almost half compared to their male-led countries. So the question might be, why is this the case? So one of the attributes that the study gives is in terms of the leadership style. So one is that women leaders are risk averse. So because like you have countries that locked down when they just had 6 deaths. You have others that locked down when they just had 4 deaths. So there's Taiwan that did that. And then, okay, when it comes to risk averse, you can look at it 2 ways. So one is that they were being driven by saving lives. And then the other side is that probably now this risk aversion, because they wanted to save more lives, can indeed maybe have longer economic implications. So I know maybe someone might be wondering, but this sample size of 19 statistically is small, and the study does consider that. So what they did was they then took the female-led countries, and they decided to pair them with their nearest neighbor. So there are certain attributes that they looked at in terms of the population size. They looked at the GDP, because the argument for GDP was because the prosperity of that country might actually help them in terms of trying to control the pandemic. And then they looked at health expenditure, they looked at tourism numbers. So there are a lot of things that they looked at. And again, they actually realized that the conclusion is the same, that indeed female-led countries had lower deaths than those of male-led countries. So the only difference was in terms of the magnitude, but the conclusion was the same. And that goes back to the leadership styles, the characteristics in terms of empathy. You have, for example, the Norwegian Prime Minister who had a webinar, and I think she just focused on answering questions that children had. So this was very innovative of her, and it also just helped the kids. You have also other female leaders who were conducting like Facebook lives. So all these things actually helped too for the members of their respective countries to keep calm. So yeah, so because of so it shows that actually locking down the countries earlier compared to their male counterparts had a very significant role in controlling the number of deaths in those countries. So ladies and gentlemen, I think you can see that with this data, because just speaking on data, this actually shows you that females are they have a very important role in the public domain, and therefore with those figures that I've just presented at the beginning, it's very important for us to create spaces that allow women to take up that leadership role. So thank you so much for your time. I now want to introduce Dharmi Jatani. Over to you, Dharmi, for your presentation. Thanks, John.
Yeah, thanks, Fiona. So I guess, Dharmi, you can just continue from where Fiona left. You're on mute. You're muted. Hello, Dharmi.
Apologies for that, John. I am on now. So my name is Dharmi Jatani, and I work in the Public Finance Management Program at the Institute of Economic Affairs. And Fiona took us through the introduction, why we're having this webinar and the state of play. In the next part, I'll try some of the contribution of the Kenyan women during the pandemic. So to begin with, just a minute. Yes, we're looking at the data on employment in the health sector. This is from Economic Survey 2020. So globally, women make up over 70% of workers in the health sector. And this is according to an analysis of 104 countries by the World Health Organization. And also in Kenya, when we look at this data, it is clear that the blue bars represent male in the health sector, and the almost orange or dark orange represents the female in the health sector. So we see that in 2018, the male comprised 44% of the health sector, and in 2019 it was 45%. This goes to clearly show that even Kenya contributes to the fact that women make up most of the people in the health sector. And during this pandemic, we've seen that the health workers have been on the front line in the fight against COVID-19. So we saw, especially during the first phase, during the first few months when COVID hit, where healthcare workers were working overtime, they were working longer shifts trying to manage the pandemic. So this means that women actually were facing double burden, because as we are all aware, schools were shut down across the globe, and women are also care providers at home. So having longer working shifts and that extra additional work, but still we had women in the health sector turn up for work and yes, help us help us deal with this pandemic. Coronavirus cases in Kenya, as of March 3rd, the confirmed one was 106,000, while the casualties are 1,866. We have 86,000 recovered cases. So this actually goes to show that in their capacity, that both men and women have been trying to deal with these numbers of confirmed cases, helping them with the recoveries, and they risk the chance of being exposed to the COVID-19. So both male and female they go back home in the evening, so even putting their families further in the risk of contracting COVID-19. But as we see on this chart, women are more, meaning that they will disproportionately carry the effects of the pandemic more. And so we are not only talking about the fatigue from working longer shifts and having to do more care work at home since children are home. There is also the emotional and mental exhaustion. As we are aware, the pandemic wasn't something that was planned for. So the people in healthcare, they were not trained to actually deal with a pandemic. So it was something new for everyone across the country, and the people in healthcare had to actually quickly match up to the demands. And yes, there were no psychosocial support, and even challenges of funding and unavailability of the protective equipment were some of the challenges that the healthcare workers had to work through. And yes, but the good thing is that we are still able to manage compared to other countries. We don't have as much casualties. Yes, so that goes to show us that women actually play a greater role. We saw the CAS, Dr. Mercy, always giving briefs and updating us on the number of cases, but there are also these women in the hospitals, the caregivers, the nurses, who are also doing other work. So it's important to have women at the higher levels of policy making, but also we need to appreciate the role the women on the groundwork and in the healthcare facilities are doing to help with this pandemic. Moving on, we are going to look at employment in the education sector. We have chosen pre-primary and primary school because I think that's where the highest level of management is for teachers, in that students in pre-primary and primary are quite young, and it takes a lot more work from the teachers to actually support them during the pandemic and all the choices of distance learning that were enforced. So again, looking at this data, the blue bars shows the number of women, and also apologies, in the previous slide, the values at the top shows the number in thousands of the male and female in health sector. So here in 2018, when the male were 44% of the health sector, they were 66,000, and female were 82,800. So it shows even in numerical value and the percentage proportion that women make up the larger share of workers in the health sector. So similar for representation in education sector, where we see that in pre-primary and primary school, the situation is a bit different for secondary school and tertiary, where there is a reverse of this picture. But in pre-primary and primary school, it is evident from this chart that women make up the larger share of teachers in the two levels of education. So in 2019, we had 61.6% of female teachers. That was 191,800. And we had 38.4% of male teachers in the two levels, and that was 119,300. So COVID-19 created a very large disruption in education. Globally, most schools were shut. Actually, 94% of the world's students were home, and this number gets higher in low and middle income countries, which was 99%, because the best step to take for us was to shut down school, but in some places of the world, New Zealand, I think they didn't shut down their schools. So Kenya being a lower middle income country, so we were affected because most students had to be home. And again, since this pandemic was an impromptu event, teachers across the globe, not just in Kenya, were largely unprepared to actually support the continuity of learning and also to adapt to the new teaching methodologies. Teachers had to learn how to teach online through Zoom classes, yet some of them weren't even technically had the capacity to do that. So yes, there were struggles for them to first try to understand how the technology works so that they're better able to give quality education to their learners. So this COVID-19 crisis has actually highlighted how both initial and in-service teacher education are actually in need of reform, so that in case we have not just another pandemic or even a natural disaster that requires us again to work from home and learners to stay at home, so that the teachers are better equipped to be able to give quality education. Let's appreciate again the fact that teachers, even with the opening of schools now, they are at a risk of physical health. And looking at this data again in pre-primary and primary school, these are where learners are. We've seen memes on Twitter showing how kids share sweets. So it's not really logical to enforce wearing of masks throughout the day in classrooms, and teachers have to bear that burden of ensuring that students cooperate, and also teachers bear the risk of carrying back the virus back home in case any of their students has contracted the disease. And in situations where learners with disabilities are involved, it makes it even further harder for the teacher to distance and requires extra attention. So this again goes to show that teachers they have faced a greater burden, and seeing that females are more in the pre-primary and primary school level, it means that they again carry disproportionately more burden from the pandemic, especially mental exhaustion, emotional exhaustion, and also the risk of carrying back the virus home. Moving on, in the private sector, we have seen women stand up in different capacities. So policy is a responsibility of the government, but when government doesn't focus on policies that citizens feel need to be focused on, CSOs have mostly come in, and we saw that during the pandemic, where CSOs that deal with female and female empowerment and issues that concern female, like Kenya Female Advisory Organization, Coalition on Violence Against Women, these CSOs actually came together, drafted policies that are gendered in such a way that the task forces that are managing COVID-19 can actually take up these policies and incorporate. So this shows that during the pandemic, women actually stood up in their capacities to even help in policies, and we can see that through these CSOs. Another thing is during the pandemic, especially when it began, where masks were going for as high as 150 shillings, 200, and there were shortages of masks in the country. We had women in their chamas coming up to actually produce masks, and this was evident in Narok County, Kilifi, Machakos, Kwale, and Taita Taveta. No doubt that women in different counties have also taken up different initiatives, just that these were the ones that had data and were shared that we could expound on. But no doubt that another thing that women actually contribute in is the passing of messages. We have a lot of informal groups that they work with, for example, even the chamas, where when they will hear a message about COVID, I am sure most of us had mothers asking us to drink lemon and hot water and ginger. And this just goes to show that even in their own little informal capacity, women have contributed in so many ways to the COVID-19 recovery period. Yeah, so moving on to the emerging issues. During COVID, one thing that was evident was across the globe was the design of the personal protective equipment. And I would like to clarify that these are not issues that began during the pandemic. It is just that the pandemic actually illuminated more on these issues. There's a study that was done in 2017 that actually looked at the design of the personal protective equipment, and it showed that they are not fit for female. And as our data shows, even in Kenya and even globally, that women are more in the healthcare sector. And actually the healthcare sector is one of the fastest growing employment sector for women. So this means that the number of women in health sector will continue rising. So having the design of the personal protective equipment fitting women perfectly would be a good contribution in helping them do their work better. Because when these PPEs don't fit perfectly, this means they're also at a risk of contracting the virus because they're moving around with protective equipment that are baggy or they don't fit well. So again, it doesn't also consider that some women can be pregnant when they're at work. So that design does not also cater for the fact that some women will still be working during pregnancy, and it makes it very difficult for these women to continue wearing it. And for them to be able to effectively do their work, this is an area of concern that needs to be addressed, not just in Kenya, but this is a global issue. Yes, the other issue is female representation in pandemic response. Again, female representation in policy has always been underrepresented, so it's not just now during the pandemic response. Pandemic response just made it clearer. So there is a study also done by World Health Organization, and the title was Delivered by Women, Led by Men. The study shows how women are the most in nursing, in social works, but at the policy making level in health sector, women are underrepresented. And as shown in Fiona's data, women across the globe are only head of states in 11%. Only 11% of women across the globe are head of states. Only 21 countries have women as head of state, and the number was clear that even in parliamentary representation, ministers, there was a disadvantage for the women, but we could see the number spike in local governments. So we still see how women are less in policy making decision, higher positions, but they're the most in the healthcare sector, working as nurses and healthcare providers. So to actually be able to effectively deal with the pandemic, it is very important to have representation of both genders, because we both bring something to the table, and it is only fair that we have a woman at the table to equally express the policies that that are helpful to women. Yes. So the other thing is unpaid care work. Across the globe, women spend more time in unpaid care work compared to men. Unpaid care work consists of the house chores, taking care of the children, and women spend more of their time. Now, with the schools closing, women had a double burden of the double burden of having to take care of their children and also maintain their job. Also, there are women who are working as domestic workers who also lost their jobs. And this is not just a loss of job for the women, but that means that the woman of the house will now have to do the domestic work and also try help the child with the online classes, and at the same time try to be available for her own work. So this unpaid care work falls mostly on women, and we need to have policies that actually improve our health sector so that women don't have to bear the burden of taking care of the sick at home, taking care of the children at home, while still trying to be productive in their work. The other thing we noticed is a PFM program did an analysis of the financial year 2020-21 national government budget for Q1. And one thing that stood out was the low absorption rate in the health sector. As seen in this chart, on the recurrent side of the expenditure, it was 14%, and on the development side of the expenditure, it was 12%. The overall total absorption rate for all the sectors was 21% for recurrent, and for development, it was 27%. So this goes to show that during a pandemic, when we expect most of resources directed to health, being utilized and actually helping the people within that sector, we see that the absorption rates are quite low. So this means that the funds allocated to the health sector was not properly utilized, or they were not able for some reason to absorb them all. This will definitely reflect in the quality of services that we are going to receive in the health sector. So this is one of the emerging issues, and it is important to actually ensure that the health sector is able to absorb what is allocated to it, and so that it can also reflect in the quality of services. To conclude, I will emphasize that gender matters in leadership. As we have seen, women leaders, as explained by Fiona, they have done extremely well in managing the COVID-19 pandemic, to a point that the discussion has started, are women better leaders? I think both men and women are better leaders, hence we need everyone at the table to ensure that there is an inclusive response to the effects of the pandemic. As we try to achieve gender equality, even as our SDG goals, and achieving also as Kenya our Vision 2030, it is really key to actually incorporate the views and views of women in the recovery. I have seen quite a few task forces that have come up to manage the effect of the pandemic. I have seen women representation in some, and in some others it's lacking. So it's key, not just in the health task force. We need women across all the task force. There is a mental task force. There was one for trade. So I believe we need women in all those different task forces to ensure that as we recover from the pandemic, we emerge a country that is equally empowered in both genders. And yeah, as seen clearly, women leaders have totally emerged well managing the pandemic, and it might be their risk aversion nature, their decisiveness, or their empathetic nature. But all in all, it shows that women leaders have managed the pandemic successfully. And on this International Women's Day, we celebrate their contribution, not just to our lives at home, but also to the economy. And yes, I hope this presentation makes a difference and someone has learned something. Thank you so much, John.
Thanks a lot, Fiona and Dharmi, for sharing some insights and facts and figures. Both, global, a mix of both global and local statistics on women leadership, especially during the pandemic. And as a way of summary, of course, Fiona showed some evidence to back the claim. The evidence about whether women leaders are better at fighting the pandemic. And from what she showed is that the fact that women heads of state globally comprise only 11%, statistics showed that both in the number of cases and in the number of deaths, cases of death, on average, the female-led countries had lower numbers of COVID cases, as well as, and in particular deaths. Yeah. And then, of course, Dharmi has taken us through some statistics that largely show that women are disproportionately burdened in provision of public services, particularly in health and education, as well as in unpaid care work. So these are important statistics as we celebrate the International Women's Day, just to create more awareness and public education, and just to enrich the debates around issues of accelerating women's equality and basically gender equality. So with that, I will now invite participants to ask questions to both Fiona and Dharmi, or make whatever comments that they may have. Feel free to use the chat box, or even we have the icon for, you can raise your hand and I will pinpoint at you, and you can go ahead to ask whatever question or make whatever comment that you may have. Let me, as I guess, as you are warming up, to pose questions or make comments. I see one question in the chat box from Motiso. Let me read this out as, but feel free to either note your questions in the chat box or even raise your hand. So from Motiso, so what Motiso says that is all for women in leadership, and would also like to applaud the women taking charge of this discussion. So his question, or is it his question is, should we conclude that women-led countries are performing better because of the leaders in particular, or do you think that societies are ready to elect women leaders, are just more democratically mature, and that translates into a nation that better follows the regulations set by the state? Since in Kenya, Since in Kenya, for example, we have all the regulations and none when it comes to implementation. So Fiona and Dharmi, you can weigh in on this question as we wait to see whether the participants have. Sorry, there's one. I see a hand by Martin Mulwa. Martin, you can unmute yourself.
Yeah, thank you very much, John, and thank you also the presenters. I think this is a very wonderful presentation that you've just made. And it's interesting to just hear that women leaders outperform men in terms of the pandemic. So it will be really interesting to just hear from the presenters. What are some of the policy implications we can learn from these results coming in? Given that women in Kenya are quite underrepresented. I mean, it's one thing to say we need more women at policy level, but even across board, especially in the labor markets, what does this imply for women? So it would be interesting to just hear from the presenters what are some of the policy implications that we're actually learning from this particular presentation they just made. So yeah, thank you very much.
Thanks, Molo. Okay. I'm browsing through the chat box. I don't see any additional questions. So I would like to ask that maybe let's start with Fiona. Fiona, you can respond to Motiso's questions as well as Molo's. Both of you basically you can weigh in or agree on which question you would like to take.
Okay, thanks, John. So I'll address the one on Motiso, the one from Motiso. So his question is whether we can conclude that women-led countries are performing better because of the leaders in particular, right? So if you look at, it's just basically about the leadership skills first. So that's why the data presented concluded that, right? So in terms of the decisiveness, that you have countries like Taiwan that had 6 deaths and the president was like, okay, we need to lock down the country. You have others that had like 4 and they locked down the country. And this led to reduce the number of deaths and cases. But if you check the male counterparts, this was probably. So I think, yes, and this can be attributed to the difference in leadership styles. Then the second part of your question is whether societies are ready to elect women leaders just because they are more democratically mature, and that translates into a nation that better follows the regulations set by state. Yeah, I think this is a blend of both, because if you check history, women participating in leadership has it's been a journey. So you can probably attribute that to the maturity of particular states. So yeah, so that's why I think, yes, it's a blend of both, that probably the more mature a state is, the more inclined they are towards not just picking a male leader, but picking leaders because of their qualities and all that, irrespective of whether now they're female. But if they have the qualities and they have the capacity to do their job, then they'll be elected based on merit. So I hope I've answered your question. Yeah.
Thanks, Fiona. Dharmi?
Okay, thank you for the questions. And so what does what does women in leadership mean for Kenya? I mean, like, what are some of the things women in Kenya can learn from the women across the globe? I think one key thing that sounds simple but is key is that women should just have their voice, because during this pandemic, we have seen that their empathetic nature actually made these countries lock down earlier than their male counterparts. So I think we both, as the different gender, have something to bring to the table. So I think the key thing that we need to learn is women need to take up their voice and act on it. We saw, was it Australia? Mm-hmm. where the president was going online to actually speak to kids, motivate them, and tell them what the COVID is, assuring them that it's okay to be scared, and that as
New
things
Zealand.
go on, New Zealand, yes.
New Zealand, yeah.
So, yeah, thank you for the correction, John. Yeah, so the Prime Minister was going on television to actually tell people that it's okay, that the pandemic is something to be scared of, but they are doing their best to manage, and that in the end things will be okay. So these were not the kind of initiatives that the male counterpart took, maybe because women are more empathetic, and their decision to quickly close the economy when they this number of deaths, there was the risk of the economy performing poorly, but their empathetic nature made them choose lives compared to the economy. So I think what we can learn from this is women need to use their capacity in whatever way bring it to the table. We don't have to emulate exactly the male leadership and do exactly what they do. Maybe our ways of going about responding to situations and the kind of policies that women think of, maybe that is the gap that we actually need. So in response to your question, I think the greatest lesson is that women need to bring out their voices on the current issues in the country. Thank you, John.
Yeah, thanks, Darmi. Let me see whether I do not see any additional question from the chat box. Participants, feel free to raise your hand or unmute yourself. We still have a few more minutes. Again, is it Martin? Is your hand, or was this?
Yes. Sorry, I'm coming in again.
No, that's fine. Go ahead.
Yeah, I mean, thank you very much for that answer, which I think pretty much resonates with what I had. But I think specifically, I was looking in terms of policy. What should the government be looking in terms of, how to strategically position women, especially within the leadership in different sectors. So I was just keen to hear in terms of from a policy perspective, what we could learn. I'm not quite sure if my question is clear enough, but I was more so looking from a policy side. What are some of the things maybe policymakers can learn from this? Thank you very much.
Thanks, Martin. Darmi, do you want to make another stab? But I will also, I can add into that. Okay, please go ahead.
Okay, thank you, Martin. I think in Kenya, because the constitution actually lays the foundation on ensuring that there's equality in representation, that is mostly in the public sector, the 2/3 gender rule. We've seen it being implemented in some county assemblies, and there's still a long way to go. So the first thing will be to actually implement the 2/3 gender rule to ensure that more women are in positions of policy making. And yes, also, it is the high time, I think, we need to package women representation in the economy, not just as an issue of social justice, but also to look at their contribution in the economy. As we have seen from the examples given in this presentation, that when given the opportunity, they actually can deliver even for the better good of the economy. So not just as an issue of social justice and because it is a requirement by the constitution, but women also play a big contribution in the economy, and that can be seen as of a missed opportunity by the government even to collect revenue or accumulate wealth, because we have this number of people missing in the labor markets. Again, another thing is to have a gender-responsive budgeting. We have seen issues affecting women and girls being incorporated in some sectors. So, for example, in education, we have the issuance of sanitary pads. There are bursaries to actually help young girls. But you notice that even in a sector like energy, where women cook using firewood, charcoal, and there's a health impact on women, we don't see a responsiveness or specific policies targeting women in all the sectors. So what is being done in health sector is great. For example, the Linda Mama initiative that helps young mothers access free healthcare during childbirth and also for the antenatal visits afterwards. So having such kind of policies incorporated across all sectors in the government could actually be very, very beneficial in ensuring that more women actually come up into the labor market and are able to benefit and also contribute to the economy. I hope that now answers your question, Martin.
Oh, yes. Thank you very much. That was quite comprehensive. Thanks a lot.
Okay, thank you.
Thanks, Darmi. I see another hand from, let me see, is it Joanne?
John, can you hear me?
Yes, yes.
Yeah, good morning.
Yeah, good morning.
Thank you very much for, the topic that you're discussing today. I think it's a very relevant topic. And my question has been, we've been fighting for women's pay generally in the public service for a very long time in this country. Even when we have provisions of law to have women issues brought to the table, even that is disregarded. So I'm just wondering, what are the issues? Why is it that it's very difficult, to just have women issues dealt with and women given opportunities? What are the lessons that we can learn from countries that you mentioned, like New Zealand, and those other Nordic countries that really are gender responsive? We have, like one of the presenters has said, that now we have a gender responsive budget making process. Are these things really working? And if not, what is it that we need to do? And what can we learn from those other jurisdictions so that we can improve? Yeah, thank you.
Joanne, let me see any other, so that we can combine the questions. Okay, Fiona, Darmi, do you want to?
Okay, John, thank you so much for your question. I know it is so easy to give up when all your efforts are not being put into consideration. But I can say that we've been making progress over the years, even in terms of election, because that is where the Constitution actually gives the recommendation and data is available that we are able to actually track. I think the trick here is to be persistent and also use the women champions in parliament to actually ensure that policies that better women are implemented. So, for example, as IEA, working on the gender responsive budgeting in partnership with Kenyatta University, one of the challenges that we are having is even analyzing the disaggregated data in terms of how much do women earn in every sector, so that we even have a data that shows the underrepresentation or the underpayment that we can use to actually request for policy changes. So the first thing that needs to be done is that data across all sectors, especially the government ministries, so that we are able to see which sectors is it that women are being underrepresented, which sectors is it that women are being paid less than their counterparts. So an availability of data makes it a bit challenging to outrightly say that nothing is being done. But I believe the more we continue having such kind of communication, and for the longest time, even when the president appoints a lady, the conversation in the public is always it's the president's girlfriend. So, or she has an association with maybe a politician, like they believe that women can't get there through merit. So what we need to do is keep on showing them that women also have an opportunity to contribute to the betterment the economy, which is for the better for the betterment of everyone, both the economy and both the livelihoods of those women. So I think the key thing is to fight for women's right, not just because it's a social justice issue, but also because the economy misses out on a lot when women are denied the opportunity to participate. John, you can expound.
Yeah. Just to add,
John,
thanks.
Sorry, John, can I go?
Yeah.
So I think one of the things that I can say, and that Darmi has touched on briefly, is that when you look at the journey of gender equality in most countries, including Kenya, it's a process. Like where we were, say, 20 years ago is not where we are now. But even if you check some of these policies that government comes up with, they are mostly inclined to areas of social and human development. So I think one of the things that government can actually do is try and enter the economic and spaces, and these policies that are put in place, they have to be followed with resource allocation. Because I feel like, and this is me, not IEA, but I feel like government will come up with these policies and strategies in order to help women, but the resources that probably have been allocated are not working. So you have a lot of the private sector coming in to say, for example, the example that was given in giving girls sanitary towels to ensure that they go to school and all that, and yet you find that they have say a provision for that or such a thing. So yeah, so I think it is following up these policies with the resources and making sure that they are implemented. Yeah.
Thanks, Darmi and Fiona, for those responses. I mean, just to add to the question posed by Joanne, no doubt, of course, the issue of putting efforts towards enhancing gender equality must be it's a collective effort, and no doubt there's no magic bullet to it. And of course, for Kenya, we've made strides in terms of having in place legal and institutional frameworks. But some of the gaps, as has been mentioned, are to do with just the aspect of implementation. Of course, given the financial implication that implementing some of these policies entails. Different groups, for instance, we are currently, the IEA Institute of Economic Affairs, as was mentioned, we are doing some work under the hub that is being led by KU on initiatives of what works for women economic empowerment. So the idea here is to bring forth evidence that can be used to enhance or inform policies, as well as speak to some issues related to where resources should be put in towards ensuring that some of the initiatives that we have in place, initiative towards empowering women, will work better than they are currently are. So we have certain groups, of course, looking at it from the evidence perspective. There are certain things that need to be done from a legislative perspective. So the idea is to use this evidence to engage both, to engage policymakers, whether it's from the executive or the legislative perspective. And this must be an ongoing, it's an ongoing process, and it's a journey, as has been mentioned. And some of the things that we've done, for instance, when the Institute of Economic Affairs did some work on the cost of implementing the 2/3 gender rule, the idea was also to inform or debunk the myth that the challenge there was the issue of resources in order to implement that. And what we found out that it doesn't, implementation of the 2/3 gender rule looking at different scenarios is not a costly affair. So the idea of this, the objective of bringing evidence is basically just to either debunk some of the myths or some of the perceptions that are held by mainly, especially the government, and just to hold them to account on some of the provisions that we have towards empowering women, or basically towards accelerating issues of gender equality. And of course, even having this kind of forum, the idea is also just to enhance education, bring evidence to bear, and inform public debate, so that collectively this issue is picked up by government, so that we put pressure where we need to put pressure, and just continue to educate the public and to continue to basically put in pressure on the government to do what it is supposed to do in terms of enhancing gender equality. Yeah, thank you.
Maybe just to follow up, John, team.
Yeah,
Can you
John.
hear me?
Yes.
Yeah, thank you so much for the response. And I really like the fact that you're undertaking an evaluation on that, because I feel that sometimes when we have provision of law, certain actions to be taken, it means that we may have developed laws that are not practical, right? So yes. I think it's a good idea that you are making an evaluation, doing a study to determine how best women can be leveraged, how best they can be empowered, so that even as we are developing legislation, then we know that a legislation that we are developing will really be implemented and work. Because what is happening is sometimes we may rush to implement legislation because it has worked, in certain jurisdictions. But like I've mentioned on the comment on the chat, that we are patriarchal society. So you find even those women themselves do not feel confident in taking up leadership positions or in taking up those responsibilities that we expect them to, to take. So that study, I think, will be of essence. And I would advise IEA maybe to just share, widely, and maybe have some public forums where women can be invited, and so that they get to understand exactly what the issues are. Because I've never understood why in school we compete. We compete without having to be really supported per se. Maybe I'm urban brought up, I don't know. But I think we need to also instill that sense of competition in women as well. Because sometimes it's having a backlash. You find that when you have programs that are benefiting women, it's having a backlash in society, and you find even the boys who are supposed to be understanding why women should be leveraged are not very supportive of those initiatives. And it's something that I see coming up quite a lot of late, where young people, young males, are actually very resistant to these, programs that are empowering women. So even as we empower women, let's not forget about the male. We need to bring them to the table so that they also understand why women empowerment is important. And I think if we work the journey together, then a lot more will be achieved. Thank you.
Thanks, Joanne, for that comment. We take note of it. Now, I would like to, I think we are almost coming to the end of our webinar. So I would like to invite both Fiona and Darmi to make their closing remarks. But I also see another question from Mutiso. So in making your closing remarks and just sharing with us where we go from here, please, either Darmi or Fiona, you can respond Mutiso's. Of course, it's both it's a comment versus semi-comment, semi-question. So, but if you have anything that you like to say in regard to what Mutiso has mentioned, then please feel free to do that as you make your closing remarks.
Okay, thank you so much, John. First, Mutiso, yes, it's true. We are a patriarchal society, and yes, it will take a while because change is hard, change is not easy. But I believe one woman at a time, we will actually get to a point where people acknowledge women for their qualities and not just look at them as caregivers and caretakers. And yes, so that is more of a comment, and also only time will tell if we will be able to eliminate those chauvinistic biases. But the point is not to stop. We should keep trying. All women out there to also play their part in just becoming who they want to be and being vocal in their positions, so that more people actually see that women have the was not there. And it's a bit frustrating to see that even the 47 positions for the women representatives, people expect so much, but I believe we should also give them some time, and hoping that as time goes by, there will be some change that will come out from all the policies that are being targeted to enhance gender equality. In conclusion, I'd like to thank everyone for being part of our webinar today, and to all our colleagues who helped us put this webinar together, and to John for moderating the session for us. And happy International Women's Day to all women out there. And let's not tire of doing the little things that will eventually make the difference. Have a lovely weekend.
Thanks, Darmi. Fiona?
Okay, thanks, John. I think for me, it's just to say that I believe that it's critical that women are in leadership positions, both in the private and the public sector. And as a society, we should continue to get them into these positions on merit, of course. Yeah, and happy International Women's Day on 8th. There's a hashtag going around. So make sure you take a photo and celebrate the women in your lives. Thank you.
Yeah, thanks a lot to both Darmi and Fiona for sharing some insights and basically adding our voice as IEA to and in celebration of International Women's Day. And to the participants, of course, we are grateful for participating in this basically, and just to welcome both Darmi and Fiona that we thank you for the questions that you posed and just engaging in this webinar. We'll be posting our presentations on our website, so feel free to visit our website at your own free time to just go through the presentation and other publications and policy work that we have done that may be of interest to you. And we have also lots of stuff that is also related to the subject matter for today. The other note is, of course, we also welcome you to look out for more of our webinars that will be coming up soon in the coming weeks on different issues. We have one, I think, next week that will continue. We have this discussion on the Constitutional Amendment Bill. So please look out for that next week. We'll be making posting that in our social media pages. Otherwise, thanks a lot and have a good afternoon. Happy International Women's Day. Thank you. Bye-bye.
Bye, John. Thank you so much.
All right.